First, let's talk about a canceled patient, okay? A canceled call, rather. Canceled calls, there's a few things you really need to know, and a couple things are specific to the state of New York, but in general, canceled calls are canceled calls. So in other words, if there is no identifiable person or patient for whom 911 was called, you might have yourself a canceled call, okay? But that needs to happen prior to arrival versus after arrival. In the state of New York, there is no canceled after arrival. If you read the state definition of canceled, it's a prior to arrival type designation. 3, you really need to be canceled by like a dispatcher or fire EMS or law enforcement, someone who has some information about the scene beyond what you had when you were dispatched, and someone who can verify for you that there is no person in need of your services or assessment. And then now the question you need to ask yourself is, you've been to the scene, did you speak with a person for whom EMS was called? Then it's not a canceled. Okay, guys? It's not a canceled if you talk to someone for whom 911 was called and they tell you, no, I don't need your assistance. Yeah, I don't know why they called. I was never hurt. I was never injured. You guys can just take off. You're not canceled. That's a refusal. And you made contact and you made some sort of cursory assessment when you spoke to them. So get yourself a refusal for that one. Next, we're going to talk about refusal.